All right, we're bringing this now. South Africa's medical personnel have held a conference celebrating lessons learned about the COVID-19 pandemic. Also on the agenda was the criminalization of medical errors, as well as managing difficult patients. But to discuss and unpack on the weekend's meeting is the South African Medical Association's national chairperson, Dr. Angelique Coetzee. Dr. Coetzee, always a pleasure to talk to you. This morning, let's talk about what came out of the weekend's meeting. What were some of the highlights in terms of what was on the agenda?
Good morning, and good morning to all your listeners out there and viewers. Yeah, it was a very interesting weekend with very relevant topics. If we look at the first meeting that we had on Saturday afternoon, it was by Prof. Karim, and he spoke about the lessons learned. There's a lot of lessons that we learned regarding the behavior of the virus, and as he also showed us stats that we can expect the fourth wave during December. Only then will we know what the impact of the current vaccination drive would be. We hope to see less severe cases, as well as we know, and I need to keep on emphasizing this, we know that you will be around about 70–75% protected if you're taking the vaccines, the Johnson & Johnson and the Pfizer for now. So you can still get infected. We know that you can still get severe disease, but your chances are so much reduced. Then, very interesting, if you look at what Prof. Marty said, he spoke about the post and future. Interesting that the two specialists, Prof. Karim was saying that if we look at the healthcare workers for the second vaccine, a booster vaccine, it should be Johnson & Johnson. Prof. Marty said, no, it can be a hybrid with Pfizer. So it's interesting to see the big guys differ a bit. Yeah. So very important, the mental health, very, very, very important. And the stats was really horrendous around the healthcare workers. Yeah. And post-traumatic stress, 24%. And then the clinical management of these patients by Prof. Mendelsohn in hospital setup. Yesterday was the big one. The one with the criminalization of the medical errors. Prof. Graham Howard gave us the views from, he's from medical MPS. Right. But what was very eye-opening was the data that Advocate Motibi gave us. And that's around how bad the fraud in all of these provinces are. Or in most of the provinces are. Yeah. And then the doctors themselves, the criminal behavior and what is done there. And Dr. Mark Heeman gave us a very, very practical way forward and what needs to be done. And SAMA will have a bosberaad on this. It's already been planned.
If I can just jump in, Doc, we've spoken about, of course, perspectives from, the virus, the vaccines, as well as healthcare workers. What were some of the concerns that the medical practitioners sort of resonated with when it came to difficult patients, but also human behavior and how South Africans have responded, to the campaigns that you've set out, to the communication that you have constantly been putting out there about both the virus and the vaccine?
Yeah, again, there's two very nice papers been written about the difficult patient, and, about between 12 and 20% of patients seems to be a difficult patient to manage in a setup of a medical practitioner. And then what is your right as a doctor? You don't want to see a patient that's rude, or a patient that thinks you are rude because you are running behind time. And it becomes extremely difficult. He talked about the hope where the doctor feels hopeless, angry, getting anxiety, and then don't know what to do. People think the doctors always know what to do, but there's a syndrome that they are developing because of those difficult patients, as well as the stress, especially around COVID-19. From SAMA's side, we partnered with the Society of Psychiatrists as well as another group out there to help and try to get our doctors to speak to them. There's a 24-hour call center, but it's difficult. It's not easy. Doctors are not known to speak out about how they actually feel internally. It is something like, you don't do that. So it's difficult.
Well, I understand that, of course, this particular conference, Doc, is still continuing, at least until the 29th of August. More conversations expected. Quite important to see, doctors uniting there and just having conversation about their struggles, but also their progress. We'll have to leave it there. Dr. Angelique Coetzee, thank you for your time this morning.